A month ago, MercyOne Siouxland Medical Center in Sioux City announced changes to its trauma and cardiac services.
MercyOne was a level 2 trauma center, but dropped to a level 3 trauma center and also changed some of its cardiac services. At level 2, trauma centers provide comprehensive trauma care, including major surgeries and higher levels of care. Level 3 means that hospitals still care for patients and stabilize them. But if necessary, the patient would be transferred to a hospital with higher critical care management. The changes at MercyOne include pausing the provision of cardiac surgery services, including open heart surgeries for the foreseeable future.
Uncertainty followed the announcement that came just last month. Today, KTIV's Taylor Deckert sat down with doctors in MercyOne's Heart and Vascular Center to explain how these changes impact the services.
Yeah, so Taylor, what did the doctors share with you today?
Yeah, so there have been a lot of questions from the patients. Many already have some fear when they're going to the hospital. How do they navigate the recent changes at MercyOne? Some have asked, is there a surgeon or is there not a surgeon? Doctors say they're doing everything at MercyOne in the cardiac surgery process except for the actual open heart surgeries. Think about it as an alphabet. MercyOne does everything from A to Z. Now, MercyOne can do A through O maybe now to prepare a patient for open heart surgery. Then they're transferred to another hospital for the actual surgery, but then they come back to Sioux City to finish the rest of their recovery services, X, Y, and Z.
Our mission is still to take care of our patients, to provide them the best care that we can, and that's what we are currently still doing.
The change came as a shock to Siouxland, the loss of some cardiac services. But internally in the hospital system, doctors say not much has changed. MercyOne says this was caused by the loss of the hospital's only cardiothoracic surgeon a few months ago. He was the point medical person for all things related to do with open heart surgeries.
I would say this is one of the essential parts. We can do at least half of what is needed to be done, which is stabilizing the patient. Then we can transfer so that whatever needed to be done at other places can be done in a timely manner.
Dr. Shaw focuses on abnormal heart rhythms and shares the changes don't impact a number of services.
I'm still doing all the same procedures that I was doing before we had the surgeon, and now after that we don't have the surgeon. I'm able to do pacemakers, defibrillators, pre and post procedure, seeing them in the clinic. We're still going to continue to do them over here. Those are not high-risk procedures to begin with.
It's been about a month since the change. So far, doctors say 3 patients have been transferred to another hospital for open heart surgery. There have been other patients that could have had an open heart surgery done, but the doctors say there are alternatives to take care of their issues in Sioux City, like heart stents.
95% of blockages over the nation would now be treated with stent procedures.
He added MercyOne did hundreds of stent procedures last year alone.
We have not done many surgeries in this hospital, open heart surgeries. I think we have done probably around 25. But if you see how many stent procedures we did in comparison to the open heart surgery, is significantly high. So I think we did probably like 550 stent procedures.
Patients will still do preoperative work with tests before being transferred. When they're done, patients will still get post-surgery care at MercyOne in Sioux City.
Aside from cardiothoracic surgery, we will continue to provide the best available care and make sure they live their best and healthiest life.
The surgeon who left a few months ago caused a ripple of other layoffs. MercyOne explains those other positions were non-direct patient care and don't correlate with how the cardiac lab functions or the ICU. There are still some unknowns when it comes to other departments like the emergency department, but we will continue to push for those answers. Matt, Jessica.
All right, Taylor Deckert live tonight in the studio. Taylor, thanks for the update. Meanwhile,